You may have seen different versions of this very colorful chart from the Centers for Disease Control, given that we've been flooded with more and more new contagious coronavirus variants in the past year. This is the CDC's variant proportion chart. It tells you how much of the coronavirus floating around our country is from one variant versus the other. And it shows you how those proportions have changed over time, which is why you get that left to right color gradient. This chart, specifically the greenish teal bar on the chart, has sparked a bunch of headlines this week about the new subvariant of Omicron with the very clinical name BA.5. Some headlines are calling it, quote, the worst virus variant. BA.5 is now the dominant strain in the country. It accounts for more than half of the country's COVID cases. We know it's more contagious than any previous strain we've come across so far. And experts say there are some early signs that this variant might make you slightly sicker than previous strains. We're waiting to get more data about that, but here's why it matters. Let's have a look at that chart again. What does it tell you? It tells you, yes, BA.5 is the dominant strain. You can see that on the right side. It also tells you that this virus keeps on changing. It keeps mutating. Every couple of months, it looks like there's a different dominant variant or subvariant. Every couple of months, the most prominent color on this graph changes. The vaccines and treatments we currently rely on to rein in this virus are based on old strains of coronavirus, and so far, that's worked out okay, perhaps until now. Many experts say this new strain of the virus, BA.5, is changing the playing field under our feet as we try to finally defeat this virus. The reason is something called immune escape. BA.5 is getting around the immunity built by recent COVID infections and vaccines better than previous strains did. Already, daily case numbers are trending upward. Take a look. That's on the right side of the screen. It doesn't look like much, but it's a bit of a trend because of BA.5. Anecdotally, it just feels like more and more people around us are testing positive. Hospitalizations in this country have also been trending up steadily since our most recent COVID spike in May and June. We know from our winter battle with the original Omicron variant that if this virus can create enough new cases quickly, there can be crippling spikes in hospitalizations, even if it's not a whole lot more virulent than previous strains. So I have questions about what all this means for us and what we can and should do to protect ourselves against this current version of the virus. And I know who just to ask. Joining us now is Dr. Vin Gupta. He's an MSNBC medical contributor, critical. You'd think I know this, right? Vin, after introducing you, how many times have I introduced you? Critical care pulmonologist and a faculty member at the Institute for Health Metrics and Evaluation at the University of Washington. We have been speaking for over 2 years now. Dr. Gupta, thank you for being here. On one level, we do not have the level of tension that we had in March and April and May of 2020. On the other hand, we have this new strain, and we're a little confused as to what we're supposed to do about it.
Ali, it was great to see you. Good evening. It's true. And the fact that really worries me is that 3 in 4 adult Americans that are eligible for their next booster shot, number 3, that next booster shot, have decided that they're not going to get it. Or in some cases, if you're eligible for that 4th shot, they're not going to get it. That is concerning in this era of a more transmissible variant, because Ali, come the winter time, if we're not up to date with our vaccines, those individuals who are higher risk are going to be the most likely to end up in the hospital, because while we focus so much on antibodies, blocking the virus from causing us to test positive, blocking the onset of a sore throat, the really key component here is something called T cells that harbor pretty much in our lungs. They help prevent severe infection from occurring, but it turns out those T cells do require periodic boosts. And the people that need those boosts the most are not getting them. That's why we're really concerned about the winter and potentially surging again in the hospitals.
So I know they've been throwing away dosages of vaccines because they have a certain shelf life, and it's not just in the United States, Canada, Germany. A lot of places are getting rid of vaccines. Do you feel what's supposed to happen? Is it just a matter of everybody being up to date on their vaccine regimen, or are we discussing more vaccines? And what about this immune escape business? The idea that this new variant, the BA.5, seems to be able to bob and weave its way around your inherent ability to fight this off because you've had COVID or because you've been vaccinated properly.
Well, Ali, that last point, let's take that last point first. That is not unexpected. In the setting of a contagious respiratory virus like, say, flu, for the last 40 years, all of us have been getting immunized against flu for much longer than that. Flu evades, it causes immune escape all the time. We test positive for flu even if we've gotten the shot, but it's about 50% effective at keeping you out of the hospital. That's where we're headed. A vaccine, we're already there, a vaccine that is going to keep you away from somebody like me, but not prevent a positive test. This is entirely expected. And we're going to have a more contagious variant likely occur down the road. We shouldn't be surprised by it. To your point, is there going to be an up-to-date vaccine come fall? For everybody wondering, should they wait for that 5th booster shot? If they haven't gotten their 3rd shot, should they wait till fall for an up-to-date shot? I would recommend that you get that up-to-date shot if you haven't already. But once it becomes available in September, that's going to give you strong protection against infection for a period of time, but certainly keep you out of the hospital. More broadly, Ali, we need to be thinking about a therapeutic strategy. I know the Biden administration is thinking about it. They're trying to institute test to treat, but we need to be clear-eyed about what a therapeutic strategy looks like come the winter and make it even easier than it is now.
In terms of prevention, a lot of people talk about the fact that, it's becoming just like the flu. But the distinction is you always know when you have the flu. You are contagious once you have it. This continues to be something where people are contagious in many cases without having any idea that they're carrying the virus.
That's right. That's right. And so asymptomatic infection this is a big reason why this has become a global pandemic. People are carriers. They don't know it. They're fully vaccinated, but they are still potentially contagious because they have vaccine breakthrough infection, but they don't have symptoms. Turns out in the setting of BA.5, for all your viewers out there, just because I've gotten this question a lot, you can be contagious for a longer period of time. Conventional wisdom in the era of, say, the Delta variant was 5 days and then you're good. If you test positive on day 0, day 5, you're feeling okay. You can take off that mask potentially. In this case, you're contagious up to potentially as long as 8 days. So contagiousness is for a longer window of time. Important for people to recognize that. If you tested positive, you're fully vaccinated, when can you take off that mask if you're otherwise feeling better? When that rapid test goes from positive to negative. If there's enough to infect, there's enough to detect. I didn't make that up. Somebody else did. But it's a good truism to live by.
Vin, thanks as always for being so helpful to us in understanding these complicated matters. Vin Gupta is an MSNBC medical contributor, a critical care pulmonologist, and a faculty member at the Institute for Health Metrics and Evaluation at the University of Washington. As always, thanks for your time, friend.